Today's webinar is about how exercise can impact your recovery. We chose today's topic because it's important for patients to understand the benefits of exercise to your treatment recovery. We are very excited to have Dr. Pophali share her expertise on this topic with us today. Dr. Priyanka Pophali is a faculty member in the Division of Hematology, Medical Oncology, and Palliative Care at the University of Wisconsin-Madison. She is a clinical researcher with a focus on lymphoma, cancer survivorship, and cellular therapy. And with that, I will turn it over to Dr. Pophali for her presentation.
Thank you, Hannah, and thank you to the HealthTree Foundation for this invitation to talk today, and to all of you for joining us to discuss this important topic. I am just going to start by sharing my slides. All right, are we able to see things, Hannah?
Yep, that looks great.
Awesome. So I know this is meant to, the title given to the topic today was how exercise can help in recovery for lymphoma patients, but I think it's more important to think about this as living with lymphoma. And so we're going to talk about the symptoms of fatigue and the benefits of exercise throughout your lymphoma journey, whether that is before you were diagnosed, during your treatment, or after as you continue to live with and beyond your lymphoma. I do research in the lymphoma space, including clinical trials, but none of those funding sources are relevant to this talk today. And I do want to acknowledge that I am a lymphoma physician and not an exercise specialist. And I do acknowledge that this slide set here has been borrowed from shared slides and information sent by colleagues who are exercise experts from Canada, from Mayo Clinic Rochester, as well as here at UW-Madison. So the goals of today's session are, we'll talk about differences between fatigue and cancer-related fatigue, discuss some formal, informal tools to help manage this cancer-related fatigue, review the benefits of physical activity in lymphoma in addition to just management of fatigue, and then talk about some practical suggestions to how people can get started or increase their physical activity levels. So let's start by asking the question, what is fatigue? So it is a subjective feeling, which means that fatigue that one individual experiences can be different from fatigue another individual might experience. It can be used to describe the difficulty or inability to initiate activity, meaning having a subjective sense of weakness or difficulty getting started with activities. Reduced capacity to maintain activity, meaning you're able to initiate an activity you wanted to do, but get tired easily and have to quit before you complete the activity. Difficulty with concentration, memory, emotional stability during an activity, described often as mental fatigue. Sleepiness or an uncontrollable need to sleep or rest. And so why are we talking about fatigue? Because it is one of the most commonly experienced cancer symptoms, especially in lymphoma patients. It is a very distressing symptom and can be bothersome even more than pain and nausea. And that's because pain and nausea can be treated with pain medications or anti-nausea medicines, but there isn't something that can fix fatigue. And so it can be very distressing to experience. And almost every patient experiences some degree of fatigue during active treatment for their cancer, but up to a third of patients can experience fatigue in the post-treatment period, not only in the weeks following cancer treatment, but up to months and years. And again, this is more relevant to lymphoma patients where prolonged fatigue is often reported. And it is a symptom that profoundly affects the quality of life, not just for the patient, but their family members, caregivers, loved ones. And this includes physical, psychosocial, as well as effects on economic and occupational aspects of life. And what causes this fatigue in cancer patients or lymphoma patients? It's very confusing and complicated because it is often multiple factors and very hard to pin down one single cause. The mechanism of cancer-related fatigue is unknown, but likely a contribution of many different factors. This is often underreported by patients in studies that have been done in this space because patients consider it expected or inevitable side effect of treatment, which, even though it may be true, isn't always something they can't do anything about. And that's what we're going to discuss today. And then patients don't report fatigue because they fear of being perceived as a complainer. And while some of it is expected with cancer treatment that your healthcare team might educate you on, it is important to always discuss it with your healthcare team and physician, discuss your level of fatigue, change in the level of fatigue, and it's helpful to sometimes rate it on a scale of 0 to 10 so that you can compare your level of fatigue today versus at the last visit or in the future. And cancer and chemotherapy, as you can see, are not the only causes here. And cancer-related fatigue, which we already kind of briefly touched upon, it is a distressing, persistent, subjective sense of physical, emotional, and or cognitive or mental tiredness or exhaustion related to the cancer and or cancer treatment that is not proportional to the recent activity and interferes with usual functioning. It differs from fatigue that is not cancer related or in everyday life, which is usually temporary and relieved by rest. And so cancer related fatigue may not be relieved by rest and is often persistent for a long time. In terms of patterns, some patterns of cancer-related fatigue can be predictable, such as during chemotherapy, I tell my patients that fatigue can be cumulative. It can be cyclic, meaning you feel more tired during the first couple weeks of chemotherapy, such as R-CHOP for diffuse large B-cell lymphoma. But in that third week, before you do your next cycle, you might feel recovery in energy. And that pattern repeats itself. However, it is also cumulative, meaning your energy level never completely recovers before each cycle of treatment. And so cycle number 4, 5, and 6 can be harder in terms of energy levels compared to cycle number 1, 2, and 3, where you're starting off maybe in a better space from an energy standpoint. And so worse towards the end of treatment, but then there is recovery after treatment is completed. However, the pace of that recovery can be different for different individuals. However, 1/3 of patients can continue to experience fatigue many months or years after cancer treatment is completed. And so this is the pattern that I just described, where the energy never recovers completely before the next cycle of chemotherapy, but then recovers gradually in the post-treatment period. Now, this is true for the fixed duration treatments, such as 6 cycles of chemotherapy. But as we are using different targeted agents for our patients with lymphoma that has returned or relapsed lymphoma, the treatment patterns and relationship to fatigue can be very different. And so chronic treatments, such as pills or infusions that continue for many months or years, can certainly have different patterns of fatigue that could be persistent. What contributes to cancer-related fatigue? There could be medical issues that your physician or team can clarify, such as the expected fatigue with cancer therapy, fatigue related to lymphoma progression itself. Fatigue can be driven by pain, but also countered by pain medications, which can add to feeling tired. There are expected changes with treatment, such as low blood counts or anemia, which could be related to the disease or the treatment. Other medical conditions that you live with, such as heart disease, lung disease, kidney problems, bone disease or arthritis, neuropathy, which may or may not be a consequence of the cancer therapy, all can have a cumulative effect or additive effect in terms of fatigue. Additionally, medications, such as those that may be used for nausea, can make people feel drowsy or tired. Medications used for anxiety or depression can have side effects that contribute to fatigue. So you have to look at many different aspects when evaluating cancer-related fatigue. Additionally, there are metabolic changes, nutritional changes, hormonal changes that occur with lymphoma and its treatment, as well as inactivity, loss of muscle mass, and deconditioning can also contribute to fatigue. Fatigue is also an emotional or psychological state. So mood changes such as depression, emotional distress, sleep disturbance can also contribute to fatigue. In terms of treatment for cancer-related fatigue, what I have listed in this slide is the highest evidence on top, followed by least evidence as we go down the list. And the number one factor that has been studied and has the most evidence for improving cancer-related fatigue is actually physical activity. And as soon as I say this to my patients, many of them react by saying, how will I have energy to be physically active when I'm already starting off with such low energy? And I'm going to talk through this in more detail in the coming slides. But this is the most important takeaway from this talk, that physical activity actually has the most evidence to help cancer-related fatigue. Other interventions that have been studied and can be helpful, depending on the cause of the fatigue, are psychosocial interventions such as cognitive behavioral therapy, psychoeducation therapy. And so referral to behavioral health or therapy is also something that can help. Mind-body interventions have some evidence, and I recommend these for individuals who are interested in trying them out, such as yoga, acupuncture, mindfulness-based approaches, or other therapies such as music therapy, Reiki, massage, etc. And they work for some individuals and are worth trying if you've already attempted physical activity and psychosocial interventions. There is no harm to trying mind-body interventions. And then medications, there is very little evidence that they help with fatigue, and so they're not generally recommended. Just going to briefly talk about psychosocial interventions. These could include things like reframing negative thinking patterns that influence perceptions of problems and behaviors, energy conservation and activity management, which I have included in the handout at the end of this presentation. And what this really means is to prioritize and pace your activities, delegate, postpone non-essential activities, try to have a daily log to identify when you feel the peak of your energy, such as generally in the morning after waking up, which wears off by the afternoon. Then it is important to focus on your priorities in terms of activities during that time. Family member presence may sometimes distract from sense of fatigue, so having company and support through cancer and its treatment often helps. And structured support groups, such as may be available through this organization, HealthTree, is something to seek out if you are needing some support in terms of increasing your activity. Individual counseling or formal cognitive behavioral therapy is also an effective psychosocial intervention. And this is just an example of the things you can do to conserve energy. That includes planning and organization in terms of timing or spacing out the tasks that require most energy to the times when you have the most energy, pacing yourself in terms of activities, taking breaks, balancing the activities so you alternate resting and doing things, positioning. Do you need to be standing up to do things such as maybe folding your laundry or chopping vegetables? Maybe you could do those things in a sitting position to conserve some energy. And then prioritizing, figuring out what are the most important tasks to get through your day versus which ones can be delegated or left for later. Now let's talk about what I think you are here to hear, physical activity versus exercise, and what's the difference there, right? So physical activity is a term that's used for any movement of the body that uses energy, versus exercise is a planned, structured, repetitive, intentional movement performed to improve or maintain one's physical health. And what is more important? Is physical activity more important or exercise? And the answer really is physical activity includes exercise. And so any physical activity is actually beneficial for cancer patients, including lymphoma patients. The physical activity recommendations from national organizations used to be 150 minutes of moderate to vigorous intensity aerobic activity and 2 strength sessions per week. And this has been recently updated in 2019 to moderate intensity aerobic activity at least 3 times per week for at least 30 minutes. Sounds a little more doable, right? 3 times per week, 30 minutes of activity in terms of moderate intensity aerobic activity, with the addition of resistance training at least 2 times per week, using at least 2 sets of 8 to 15 repetitions. And we know from studies that have looked at this that hematologic or blood cancer survivors, that would include lymphoma survivors, don't often meet these guidelines. Only about 10 to 22% meet the aerobic activity guidelines, and only 10% or so meet the strength guidelines. There are great benefits to regular exercise, which includes reducing fatigue, increasing physical capacity, improving strength, weight control, reducing the risk of other health conditions such as cardiac or heart issues, chronic diseases, improvement in mood, mental health, sleep, and overall cognitive functioning or mental health. And it also improves quality of life as well as survival, not just overall, but also lymphoma specific survival. Now, we know that when someone has a diagnosis of a blood cancer, it causes a lot of changes in their body. This includes physical deconditioning related to the hematologic cancer, as well as the effects from the anti-cancer therapy, which includes chemo, radiation, immunotherapy, and targeted therapies. These include changes in the bone marrow, such as low blood counts causing anemia, bleeding risks, heart issues such as remodeling of the heart causing cardiac dysfunction, arrhythmias or irregular heart rate, skeletal muscle loss and atrophy, as well as changes in terms of the vasculature with endothelial dysfunction, and increased risk of cardiometabolic diseases, as well as reduction in functional capacity. Any increase in physical activity, or rather any decrease in sedentary behavior, actually has the other effect. It improves all of these changes that are known to occur with blood cancers and their treatments. So really high levels of overall physical activity have been associated with enhanced heart, blood, and muscle health, which is not new. And breaking up prolonged sitting time by standing or light intensity exercise, even such as walking, can provide beneficial effects. And so what I want you to take away is moving more and sitting less is beneficial to your overall health. Now, when it comes to cancer treatments, there are many studies in different types of cancers, including lymphoma, which talks about the benefits of exercise before treatment, or what is called prehabilitation, to build physical fitness and strength to prepare your body for treatments. This is generally recommended to build up your level of activity to meeting the physical activity guidelines, which I just showed you is 30 minutes, 3 times a week of moderate to vigorous intensity aerobic exercise. And this is data from a large study specifically in lymphoma patients that looked at the level of physical activity before an individual start of lymphoma treatment that showed that patients with a higher level of baseline physical activity before lymphoma diagnosis or treatment live longer after lymphoma diagnosis. So it seems to impact how long people live with their disease depending on how active they were before their diagnosis and treatment. In terms of exercise precautions, it is generally safe for a majority of people with lymphoma to be able to exercise, but you may need to talk to your physician if you're talking about specific exercise activities, or if there are changes in terms of your blood counts that may limit certain types of activity, such as we typically discuss patients who are at increased risk of bleeding should avoid contact sports, and this may be due to low platelets or other risk factors related to your disease and treatment. If you are neutropenic, then it may be a good idea to avoid public places such as public gyms and pools because you will be at a higher risk of catching infections. If you are anemic, meaning you have low hemoglobin, sometimes you may have symptoms related to it, such as feeling lightheaded or dizzy, having a racing heart, and therefore it may be important to check in with your health team before you exercise during those periods of expected low counts. If you have shortness of breath at rest, meaning not only shortness of breath triggered by activity, but even at rest, if you're feeling short of breath, that may be something that your team wants to investigate before you try to push yourself through exercise. If you're noted to have low oxygen levels, then you may need to be monitored closely or require certain help, such as supplemental oxygen before you exercise. If you have lymphoma involving the bones or have been told that there is a higher risk of fracture if you were to weight bear on certain bones, then it may be important for you to receive specific guidance from orthopedics or from a physical therapist to be able to exercise as tolerated, and caution may be required. And if you have other risk factors, such as increased risk of heart disease, either because of your prior history or after lymphoma or its treatment, then it is important to discuss that with your health team as well. And this list, of course, is not inclusive of all the possibilities, but in general, if you don't have any of these features, then it is safe for you to be able to exercise. And this has been shown in multiple studies that have looked at exercise during chemotherapy, that exercise is safe. It actually may improve the chances of an individual tolerating chemotherapy. It may actually reduce the severity of side effects from the chemotherapy. It helps to improve or maintain energy and reduce fatigue, and allows individuals to maintain their physical function. And we know this from a randomized clinical trial, which was a study specifically in lymphoma, looking at more than 100 lymphoma patients who were getting active chemotherapy in 50% of cases and half without. And this included all types. So it included non-Hodgkin lymphoma patients with aggressive as well as indolent disease and Hodgkin lymphoma. And what you can see in this figure is the change in physical functioning reported by these patients when they were randomized in blue to usual care, meaning no specific exercise, versus going through an exercise program for 12 weeks that included aerobic exercise training, both during and after chemotherapy. And you can see that patients in all the categories, whether they had aggressive, indolent, or Hodgkin lymphoma, reported that aerobic exercise training improved their physical functioning during chemotherapy. Similarly, when they measured fitness for these individuals based on this measure called VO2 peak, this clearly shows the yellow bars, the group that received the aerobic exercise training had improved physical fitness compared to those who did not receive that and had usual care, which is the blue graph shown here. And so what did they do in this study? Like I mentioned, they did 12 weeks of supervised aerobic exercise training 3 times per week, and this was mostly indoor cycling. They started off with 15 to 20 minutes of exercise and expanded that to 40 to 45 minutes per session, adding about 5 minutes per week. The intensity on this was moderate intensity, and then for the final 6 weeks, they did a once a week session, which was changed to an interval session to help improve the fitness of these individuals. And again, this here is showing the differences in the patients who were receiving chemotherapy on the left and those who were off chemotherapy on the right. And you can see that aerobic activity in yellow improved the physical function for patients both who were actively receiving chemotherapy and those who were off treatment. And so physical functioning improved in these exercise groups both during and after chemo, versus for patients who were assigned to the usual care arm, they had a decline in physical function while receiving chemotherapy, not as much while they were off treatment. And on the bottom, you see a second measure, which was an objective measure of VO2 peak fitness, which was also improved in the exercise groups both during and after chemo, compared to the usual care group, which had a decrease in their fitness while on chemotherapy. So physical activity not only improved function, but also preserved it for individuals going through chemotherapy. Other important findings of this study were that exercise did not interfere with chemo completion rate or treatment response. At 6 months post-treatment, the exercise group maintained the improvements that had occurred while receiving the exercise intervention. And they also saw a positive impact on happiness, depression, physical function, fitness, general health, and lean mass. So multiple benefits to exercising during treatment. There was also another study that looked at exercising 2 times per week, aerobic exercise 10 to 30 minutes, plus strength training, 4 exercises to max, and some balance training. And this study showed improvement in quality of life, reduced side effects such as peripheral neuropathy in the hands and feet, improved balance, mobility, physical performance level, as well as showed that overall the exercise group had improvement in all these aspects, while the control group showed decline. So the randomized study of exercise in lymphoma showed overall improvement in all these aspects and general health in this study. In addition, they did an exploratory analysis looking back at the outcomes of these patients and their progression-free survival, meaning how long did they remain in a remission after lymphoma treatment. And what was interesting is that they found that patients who did the supervised exercise program seemed to live longer without the lymphoma coming back, which is this red line here, compared to those who did not receive exercise. So this was a suggestion that there may be improvement in lymphoma-specific survival if patients received exercise training during treatment. And then what about if you didn't have the opportunity or the ability to exercise during treatment? There is evidence to suggest that exercise after treatment, meaning increasing physical activity after a lymphoma diagnosis, is also associated with living longer. And what you see in the graph here was self-reported increase in physical activity in blue and decrease in physical activity in green and stable physical activity in red. And so the patients who reported an increase in physical activity actually lived longer, specifically from their lymphoma. We also know from large studies looking at Hodgkin lymphoma survivors that being physically active or meeting the guidelines of physical activity, here they're counted as 9 METs per week in blue. Those who met those guidelines did better in terms of having lower risk of any major cardiovascular event compared to those who did not meet this guideline in yellow. And this is true for coronary artery disease, meaning having a myocardial infarction or heart attack, having heart failure, as well as having valvular heart disease. So I think I've shown you enough information that exercise is good for patients with lymphoma before, during, and after treatment. But there are certainly barriers, and these barriers could be fatigue, side effects of the treatment, as well as just frustration with the change in and impact of all these things in your life. And so people who may be avid, exercisers or physically active before their lymphoma diagnosis and treatment could maybe decrease their physical activity just because of the frustration and changes in their life. And so what can really help in these times is support from others, tracking your data, goal setting, using wearable devices and technology such as Apple Watches, Fitbits, or even old school diary, and just keeping a track of what you did today. Sometimes you may have access to individually tailored programs, so seek those out if they're available through your cancer center or outside in the community. And then creating community, finding people who have been through what you've been through so that you can commiserate and find motivation to do things to keep yourself active. And then the next question, obviously, is how much should I exercise? Is there a threshold? Meeting those guidelines is great, but I've never exercised in my life, maybe. And this is from our study that had looked at lymphoma-specific survival and change in level of physical activity. And what this is showing is that any improvement in physical activity is good, meaning if you were starting at 0 and reporting any increase in physical activity, you seem to have a decrease in death risk related to lymphoma. And so starting where you are and increasing to any degree, even if it means 10 minutes of walking or more time standing than sitting, you can make a difference in terms of how this will affect your health and your lymphoma trajectory. So historically, in the past, patients used to say, especially those on active therapy, it is recommended that they rest and downregulate their daily activities. But this is not our standard recommendation anymore because we know that inactivity leads to muscle wasting, prolonged rest. Like if you were to be admitted to the hospital for any reason, we know how much loss in muscle strength you can have, and prolonged rest actually furthers the loss of physical strength and endurance. And so fatigue management, the most important thing to do is to increase physical activity, and exercise is the most effective intervention than any medications that exist. And so the important thing is starting where you're at. If you're someone who's never exercised, you don't want to aim to run a marathon tomorrow, right? You want to start where you're at. Consistency is the key, and doing nothing will lead to worse fatigue. So starting and doing something and taking that first step is important. And even though the bar may be high, if you have never been active, and this is what is recommended, moderate intensity aerobic activity 3 times per week for at least 30 minutes, with resistance training 2 times per week, using at least 2 sets of 8 to 15 repetitions. What is important is to get started. And so it is important to do that safely. So check in with your doctor if you have any concerns or active symptoms that might limit your physical activity. Start slowly and build slowly. Starting where you're at is very important. And if you're unsure how to get started, get a consultation with a professional. This is recommendations that are more generic, but I think most people will be able to pick something from this list that helps. In terms of types of exercise, it's not important which exercise you choose. It needs to be an exercise that works for you. So it could be something like walking, indoors or outdoors, using a stationary or recumbent bike, or more, things like a treadmill or an elliptical trainer or recumbent stepper if you have access to those. Swimming is a great exercise, but if you have no equipment, even walking is great. In terms of intensity, we recommend moderate or medium intensity, meaning different for every individual. It should be somewhat hard, meaning you can talk while doing the activity but can't sing. And the frequency should start with 2 to 3 days per week, meaning you plan to do it 2 to 3 days per week. And as you do more, you can work your way up to 5 days per week as you're able to do more, little bit, maybe 2 to 3 minutes or 5 minutes every week. You can go up on the intensity or frequency. So for an example, this is something that was put together by one of our exercise physiologists. They recommend 3 minutes of leg stretches, 5 minutes of easy warm up, and then 5 to 10 minutes of moderate intensity, somewhat hard, meaning you can hold a conversation but not sing, and adding 1 to 5 minutes as you're feeling well able, with the goal being 30 to 45 minutes of continuous activity. And then it is recommended you end again with a 5 minute easy cool down and 3 minutes of leg stretches. When it comes to strength or weight training, it is recommended you do that 2 times per week, 8 to 15 repetitions of each exercise in 1 to 2 sets, and try to target your major muscle groups. These include your biceps, your triceps, your core, your hamstrings, and quadriceps. And again, you don't need to have access to weights to be able to do this. You can use a book. You can use a gallon of milk or half a gallon of milk, depending on where you're starting. And so equipment shouldn't be the barrier to your physical activity. And if nothing else, you can start with calisthenics, which is strength training without any additional weights. And I do have some of those examples at the end of this slide deck in the handout. And so then staying motivated is often a challenge. And so it is important to set some goals, seek out support, community, and then track your activity, whether it is using technology or using paper and pen in a diary. And supervised exercise and group exercise classes can be a great way to stay motivated. And there are a lot of community resources that are geared specifically towards cancer patients that you could participate in. And I've listed some of them here. Most of the YMCAs actually have this Live Strong program, which is directed for cancer patients and cancer survivors. They may limit participation if you're in active treatment, since they're not a medical facility, but they certainly take patients who have completed cancer treatment and are surviving past their cancer or not on active treatment anymore. And then if you don't have access to a program nearby, this website, exercisesmedicine.org, which has a section called Move Through Cancer, is very, very helpful. And again, my handout has certain printouts from this website that helps with goal setting, suggestions for activities, and things you can start doing on your own if you don't have a program or a gym that is nearby. Local support group, going for a walk with friends and family members, and then asking your healthcare team if they are aware of any resources specific to your location. This next slide just has some common questions that I have been asked by my patients. One of them is, I am not active. I've never been active. I'm more of a sit on a couch, watch TV kind of a person. Is it too late or worthwhile starting now? And my answer to that is always yes. It's always better to start now than never. And doing nothing is going to make things worse. So taking the initiative to start is always a good thing. And that first step is often the most overwhelming step. And once you get going, it's easier to keep up. Is it safe to exercise while getting chemotherapy? That might depend on your specific situation, treatment, disease, and the effects of the disease and the treatments on your body. So it's always a good idea to check, particularly if you're talking about doing something more intensive than walking or some specific type of exercise targeting specific things, trying to train for a particular goal, then it's a good idea to check in with your healthcare team. Is it safe to go to the gym or ride my bike while getting chemotherapy? So my answer to this is depends on, is it something you've been doing all your life and you want to continue to do through your cancer treatment? Then my answer is generally yes. If it is something you want to start doing, then I caution that, you want to start slowly and set expectations that your body is not going to pick up the stamina or have, the same level of endurance that you did in the past. So just having a different set of expectations and listening to your body. You do want to push your body to do a little bit more to counter that fatigue, but you don't want to push it so far that you're actually limiting, your ability to do the other things that you need to do in your life. And then I think exercise will make me more tired. Does it really help fatigue? And the answer to that is yes. There is lots of evidence in lymphoma, which I showed you, but also in many other health conditions and cancers, that exercise certainly helps fatigue. And so I have no doubt about that recommendation. So again, as a reminder to the group, moderate intensity aerobic activity, at least 3 times per week for at least 30 minutes is what's recommended. And if possible, doing some resistance training at least 2 times per week using at least 2 sets of 8 to 15 repetitions. But what's important is to start where you are, use what you have, and do what you can. Even if it means sitting less and moving more, that'll be the first step towards being more physically active. And again, this is some screenshots from the exercisesmedicine.org website, which has suggestions on what different kinds of physical activity you could do. And this is an example of aerobic activity. And aerobic activity means any rhythmic, continuous activity, doing it 3 to 5 times per week. It should be fairly light to somewhat hard. And how much? Starting with a few minutes and gradually building up to 30 to 60 total minutes over the day. And this could be 5 to 10 minutes here and there, which means it could be a walk to the mailbox and back a few times a day to start. Or you can go for a longer walk, 20 to 30 minutes in one go. During treatment, several short sessions may work better than one long one, and being active however you can is important. In terms of strength training, this could mean using hand weights, resistant bands, weight machines, or even your own body. For example, doing kitchen counter push-ups or chair squats, doing them 2 to 3 days per week with a rest day in between, starting with light effort and building up to medium or hard effort, and 10 to 15 repetitions to start for each major muscle group, which we said were biceps, triceps, core, hamstrings, and quadriceps, and build up to 8 to 12 reps of challenging effort. And other activities that also count in physical activity is doing things for flexibility, such as gently stretching your muscles 2 to 7 days per week to the point of feeling tightness, holding it for 10 to 30 seconds, making sure to stretch specific areas recommended by your healthcare provider. And one of the places I recommend stretching often is muscle cramps, and it seems to help the most. Other physical activity can be taking more steps, meaning just taking more steps, which can be counted by your phone or an activity tracker, and build up slowly. Maybe start off with a goal of 5,000 and build up to 10,000 steps per day, or doing things just for fun, which could be playing with young children, doing things like yoga, tai chi, if you have a pet, taking your dog for a walk, things like that also count as physical activity. And then balance is also important, especially for peripheral neuropathy, which is a common side effect of chemotherapy for lymphoma. Doing things like standing on one foot, walking in a line, balance beams are all helpful and count as physical activity. And so with that, I will stop my talk, but hopefully you will be having access to my slides and the handout that I have towards the end here. Again, you can find this information in Moving Through Cancer on exercisesmedicine.org. But what we have here is some sort of goal setting that you can use as a planner to increase your physical activity. It gives examples of different types of activity that you can pick from, some of which we reviewed. And then again, to emphasize, starting where you're at, using what you have and doing what you can is important. And then again, this is just an excellent handout. We have some information here about ways to conserve energy that I briefly touched upon, good sleep hygiene, and some cognitive behavioral interventions to help with fatigue, as well as some body weight exercises and examples. If you've never done any kind of resistance training, starting with body weight is often the easiest and most helpful. So with that, I will stop and take any questions.
Thank you so much for that wonderful presentation, Dr. Pophali. So yes, now it's the time for the discussion part of today's webinar. So if you have any questions about today's topic, now's your chance to ask. So feel free to drop your questions in the chat on Zoom, or you can, if you're watching on YouTube, you can drop your questions there. And the first question we have is, are there certain precautions I should take while exercising if I have a port?
Yes, excellent question. So, port, I think, is probably, the easier one because it is under your skin. So there isn't your port isn't open to the outside, but there may be some activities or things that may interfere with the port given its location. So exercises that maybe cause strain or discomfort in that area. If you are, say doing push-ups and the port is being affected by that or uncomfortable, maybe you want to avoid that. But besides that, with the port, since it is concealed under your skin, there shouldn't be any limitation in the type of activity you do. But that's an important point for some individuals who may, instead of a port, have a line, such as a PICC line or a Hickman, which is a tunneled line for certain types of chemotherapy or treatment. It is very important to know that it's not a good idea to, swim with that present, or, be in a place where you may be exposed to a lot of dust, because that can be a very easy source of infection. But with the port, I think the biggest limitation is just the kind of movements that can cause irritation or discomfort in that area, which should likely be avoided. But otherwise, you should be able to exercise.
Thank you for that answer. And then our next question is, will it take a while before I start to notice the benefits of exercising, such as the reduced fatigue?
Absolutely. So it is generally not immediate in terms of feeling better. You can have a sense of well-being from like the endorphin release from exercise, and you feel good after, just having achieved something, that feeling of accomplishment. But the change in terms of fatigue can generally take many weeks to kick in, and sometimes it can be hard to decipher. You're dealing with the side effects of treatments if you're on active treatments, and then trying to exercise. But know that all the data and all the studies have shown that exercise helps maintain your physical function. And so even if you don't feel a clear benefit right away, in the long run, you're doing something good for your body. So I just want to say that even if you immediately don't feel the benefit, sticking with it, and hopefully all the data that I've shown you has convinced you that it is a good thing for you in the short and long term.
Thank you. And then our next question is, how can I know if I'm pushing myself too hard during exercise?
Yeah. So that's always a hard one, right? And so what I say is if you are someone who has always exercised, say you used to run 5 miles a day and then you're not able to achieve that during chemo, but are able to do it maybe at a slower pace or to a lesser degree, running 2 miles instead of 5 miles. I think that's acceptable. If you're someone so don't expect yourself to improve or exceed what you were doing before just based on, the time that you spend doing a particular exercise, because clearly having an active cancer and lymphoma, as well as having treatment, is going to slow down some of your bodily activities, your endurance, and things like that. So setting expectations for yourself, which need to be realistic for where you are in your cancer journey, right? And then I say that it's always a good idea to do things to till you're tired. So pushing yourself till you're tired, and then maybe a little more, maybe a minute beyond that, right? And you don't want to do something to the degree that you're going to be limited in maybe pain or discomfort for the next week because of what you pushed yourself through in one day. So it's a fine balance, and it is a balance of listening to your body and pushing your body to do a little bit more. And I'm sorry, I can't be more specific because it really depends on your individual situation, what activity you are trying to do. And so sometimes when you are not sure about that, it's a good idea to speak to your healthcare team or seek out, an exercise physiologist or physical therapy opinion if you are really struggling to find that balance.
Absolutely, thank you. And then the next question we have is, so for someone who has been mostly sedentary during treatment, what would you say is the safest way to restart physical activity?
Yeah. So the safest way would be, to make sure you feel steady on your feet. If you have been very sedentary, sometimes just getting moving can be challenging. If you tend to get lightheaded, dizzy, or are prone to falls, you want to make sure you're doing, taking the movement in the right environment, whether that means, again, seeking out physical therapy, making sure you have someone to be with you when you take the decision to get active. And then again, being very slow, whether it means just walking around the house where you have things you can hold on to or sit down to rest, being very slow but intentional, and making sure again that you are doing a little bit more each day. So it is going to be, a slow process of increasing your physical activity, even if you're talking about coming back to where you were before starting treatment. If your disease and treatment has made you very sedentary, it can be a little bit of a slow process of recovery. But just, knowing that recovery will occur as long as you have the help and support to take those steps to help yourself.
Thank you. That's great advice. And then another question we have is, I have lymphedema. Do you know if exercise can help reduce lymphedema at all?
Yeah, great question. And I think most of the literature for lymphedema actually comes from breast cancer, where it is a very common problem post-surgery. Lymphedema in lymphoma can be different from that in breast cancer, where it is caused mostly because of surgery, versus lymphoma. It may be the cause of the disease itself, may be the cause of lymphedema, and not necessarily a surgical problem. In addition to exercise, there are specific other therapies such as massage, or there are lymphedema experts within the physical therapy team generally who we refer to in those circumstances. And they may have specific exercises and advice to help you depending on where the lymphedema is affecting you.
Thank you. And then I think the last question I see for right now is, are there professionals that specialize in cancer exercise programs, and how can I find those professionals?
Excellent. So there are professionals who specialize in what is called cancer rehabilitation. I'm not sure how well spread out they are geographically, but the website I was referring you to, which is exercisesmedicine.org, does have a way to search by zip code, I believe, in terms of finding a program. But very often it is a good idea to ask your healthcare team, because even though maybe your cancer center doesn't have a cancer rehab program, they may know about resources in the community where even though they may not have expertise in cancer related exercise, they may have experience just knowing how, prevalent cancer is. And again, I don't think that exercise is in any way specific to lymphoma or is, specific to a cancer type. So any cancer experience can be helpful, because the guidelines are pretty much the same in terms of watching for side effects, watching for any limitations, and building slowly in terms of activity level. So check out that website, exercisesmedicine.org, and maybe you'll find a professional through there. The YMCA is a good resource, and then other local organizations. We have the Gilda Club in Madison, but there may be other patient organizations, cancer organizations that may also have those resources.
Absolutely, thank you. And we actually did have one more question come through. Looks like this one's from a caregiver. So it's that my partner used to be very active, but has been feeling very discouraged after treatment. Do you have any advice for how I can help them find joy in movement again?
Yeah. And that's a hard question, because some of that could be physical limitations and just not feeling, like themselves after this big diagnosis and the impact of it and its treatment. But also some of that might be emotional, psychological, related to the frustration of what they've been through. So I think it's amazing that you're asking this. So you're there to support them. And it might be simple things like, going out or encouraging them to go out for a walk with you, or going to the store with you and walking the aisles there. So as and maybe it'll have to be in a little bit of a, not a direct way of saying, let's be more physically active, but let's just do some activity that brings joy. And movement in that activity might help them feel better, because clearly being more active is going to help with some of the mood. But if there are other things, like you clearly notice they are more emotional, more depressed, then talking to their healthcare team and bringing up those concerns might actually help, because sometimes we do need medications to help, emotional and psychological needs such as depression and anxiety. So I think all of these things together can help.
Thank you so much for that answer. And thank you again for your amazing presentation and all of these informative answers to these questions. So thank you so much, Dr. Pophali. And as you leave the session today, we would appreciate you taking 2 minutes to fill out a brief survey about your experience during today's event. You can also suggest topics you'd like to see in the future, and we're always looking to cover what matters most to our patients, so we'd really appreciate your feedback. I also wanted to quickly highlight a few more of our upcoming events. So tomorrow we have an event about clinical trials for lymphoma patients. On June 3rd, we have our bi-monthly blood cancer financial Q&A. And on June 17th, we have an event about coping and transitioning into survivorship. So we have a lot more exciting events in the works, so stay tuned. And the link to sign up for any of these events and many others will be sent out in the follow-up email. We also have a number of upcoming in-person events. So Connect to Cures allows you to connect with other patients, learn from doctors, and discover resources in your area to help you navigate your cancer. If you're interested in attending any of these events, the QR code to register is on the screen. And before we wrap up, I just want to say a huge thank you again to Dr. Pophali for her amazing presentation, and thank you to you all for being part of our lymphoma community. Your support means so much, and we're so grateful to have you here. I've included my email on this slide, so please don't hesitate to reach out if you have any questions, and I look forward to seeing you at another webinar soon.